It would be great to have a discussion on having too high libido, even on a moderate TRT dose. Any experience with that, Gil?
Too high libido. Well, a little more context would be helpful. Usually there's a honeymoon phase when guys first start out, and that usually subsides. If this has been ongoing for, several months to years, reassess what else is going on. Do you have a porn addiction? Do you have something going on in your life that's, is this your way of expressing your stress or your aggression? Some people use, especially men, men express sexuality or express aggression via sexuality oftentimes, and sometimes it could be due to some past trauma, maybe childhood trauma, and they kind of like use sexuality as a way to just kind of get out that sense of frustration. So this is a lot more of a deep dive individual question, but as a whole, if you're looking at the biochemical aspect of it, usually if you just started TRT in the last 3 to 6 months, it will subside and it will level off. It will be higher than normal indefinitely, because that's one of the beauties of testosterone, but it's not going to be at a place where you find it too high. And I will say, with regards to libido, when is it too much? I'd say when it starts to impact your life negatively, when you can't function with your daily activities, when you struggle at work, you struggle with, your day-to-day life because of it, that's when it becomes an interference, and perhaps you should, consider doing things a little differently. But this is a much deeper subjective assessment that's required with an individual rather than a blanket answer, unfortunately.